Good afternoon. You have Julie here from Sterling Insurance Group, and I'm here with Chris and Bill, and we will be answering more questions on the coronavirus. So Chris, are workers' compensation claims related to COVID-19 covered?
Yeah, Julie, that's a great question. But as it stands right now, the answer is maybe. The coronavirus disease of 2019, the outbreak continues to spread. We started receiving a lot of questions and number of inquiries in regards to the work-related and COVID-19 claims. Because coverage varies from state to state, and workers' compensation statutes also vary from state to state, any case reported would be evaluated based on the specific details and circumstances before determining if a claim was compensable or not. Our recommendation is, and from our carrier partners, in regards to any potential COVID-19 claim, should be submitted to our claim representatives so they can investigate this, in their own time and investigate them thoroughly and properly. We have implemented our infectious disease claim handling protocols and compensability. It will be based on the investigation and fact pattern of each claim. The individual facts and merits of each claim, non-hypothetical, again, are going to vary, and the answer, again, is maybe. What we are suggesting is that, again, they turn that claim into us, and we will forward it to our carrier partner, depending on who they have. And, what happens at that point is any further direction, again, will be based on the future and what's happening with these claims as they potentially come in. So the long and short of it is, yes, there could be coverage for it, but we're not sure. It seems to vary and change daily.
Okay, thank you. And are telecommuters covered under workers' compensation?
Yes, as a matter of fact, they are, and that's covered as if in the workplace or on the physical location. Each employee's home would be covered the same way as it would be in the workplace. However, the burden of proof for any injury or illness, which typically, here's the caveat to all of this, is that COVID-19, we're not sure how that's going to be covered, as I stated before, in relation to telecommuters or even on-site. Again, that's going to be up to the courts, and that's why we always stress that our clients do confirm this and do also have discussions with their attorneys. Employers can implement the following practices. Number one, they can create a telecommuting policy that outlines the employer's expectations for employees that work from home. Two, they can establish guidelines of what a home office would look like, such as the designated work area, and provide training related workstation setup and equipment setup to try to provide the safest work environment. When appropriate and possible, an employer does have a right to come in and conduct periodic checks of the employees' home offices to help identify and eliminate problems for anybody and possible hazards. And fourth is set fixed work hours and meal and rest periods for their telecommuters. Doing so can help establish whether the injury was indeed part of the course of employment.
Okay, thank you. And then is there anything employers can do to lessen the burden of workers' comp premiums?
Yes, and in fact, our carrier partners once again have come forth and said there will be no cancellations in regards to this up to a 60-day period. And, they can also, what they could do is reduce the amount of payrolls that they have, especially if they've laid off most of their workforce, if they're not able to telecommute. So yes, that would help to lessen the premium. Then, of course, once they go back to work, they can certainly reinstate payrolls back to what they were. And in the end, though, they can also, as with everybody, they have a year-end audit. So any discrepancies or any amounts overpaid or underpaid in this system, of course, will be shown at the end of an audit. And so the employer will be made whole based on that as well.
Oh, Oh, okay. Thank you. Thank you for all that information. I really appreciate it. Bill, we do have a couple questions on healthcare. So what are the healthcare options for employees who are laid off?
Yeah, thanks, Julie. So for employees who lose their group coverage, they can obtain coverage elsewhere in a few different ways. The first one I want to talk about is COBRA coverage. What COBRA is COBRA is an extension of the group coverage that the past employee previously had on their group plan, but they have it when they're no longer an employee. So the difference between that and your previous group plan is that you're now paying 100% of the premium on the COBRA plan. So you're paying your portion of the employee premiums in addition to the employer portion that they were paying, and also a 2% administrative fee. So it can be a little bit of a sticker shock for past employees when they get that COBRA notice in the mail, because it is expensive. But again, it's the exact same plan you had previously. And a couple other pros to this COBRA is that any deductibles and copays that you've paid already on the plan year will carry with you. So you're not starting over on your deductible and copays and your out-of-pocket maximums like you will be on all of the other plans we're going to talk about. And generally, your COBRA is available for 18 months after you leave your employer. But again, you're paying the premiums for all 18 months, but that is an option that you have. The next area you can get healthcare insurance is through the individual health insurance exchange. And these are ACA compliant plans. If you go to the individual health insurance exchange, there's a very wide variety of plans. So you can really customize exactly what you want in terms of network and deductibles and copays. And all the premiums are 100% age rated on these plans. You must enroll within 60 days after you lose your group coverage. And aside from, if you don't enroll within 60 days after your group coverage, you have to wait until November 1st through December 15th to then enroll in an individual health insurance plan. And then those plans become effective January 1st. And there are subsidies available based on your income level. And there's no pre-existing condition exclusions, and you can stay on the individual health insurance plans for however long you want. A third area to look at is spousal coverage. Being that you're coming off of a group healthcare plan, you do have an open enrollment period to get onto your spouse's plan. So that's even if you're just adding yourself, maybe your spouse already has a single and you're just going to make it a double, or if your spouse is on your group plan and you both go to your spouse's plan, if it's available and if they allow spouses, that's an avenue to look at. And the premiums for a spousal coverage, similar to the group plan that you were previously on, the premiums are payroll deducted, so generally those are pre-taxed. Another option is Medicaid. Medicaid is, the eligibility is strictly based on income and assets. So because of all of the layoffs and furloughs tied to the recent coronavirus, and a lot of people's income substantially dropping because of that, people may become Medicaid eligible and previously they weren't. So that's definitely an option to look into because it's a very low to no premium if you qualify. You can apply for Medicaid at any time. One caveat is it's generally a more narrow provider network, but again, it's a great option if you qualify for it because the premiums are so low and in some cases $0. One other area I want to talk about, it's not necessarily an option for employees coming off of their group plan, but being that there's not a mandate anymore to have individual healthcare coverage for adults, Michigan has a program called My Child, which is designed specifically for low-income uninsured children under 19 years old of Michigan working families. And it's $10 per month for each child, but there's no deductibles or copays, and it covers medically necessary services, things like doctor's visits, emergency services, inpatient and outpatient hospital care, labs, surgeries, x-rays, even dental and vision. And $10 per month, and the qualification is, it's pretty easy to qualify if your children don't have healthcare coverage. For individuals 65 years and older, coming off of a group plan, Medicare is definitely something they want to look at as well. The Medicare Parts A and Parts B, the two mandatory, generally speaking, if you've paid into it for more than 4 or 5 years, then Part A is going to be no cost and Part B will be around $145 a month. And then there's also supplements that people 65 and older can buy on their Medicare plan to cover prescription drugs, dental, vision, hearing. Medicare is a different program than Medicaid. But again, Medicare is 65 years or older. Coming off a group plan, definitely an option to look at. There's a special enrollment period for Medicare if you're losing your group coverage, but there's no coverage for spouses or dependents, unless, of course, they're 65 years or older as well. Now, for individuals who don't necessarily foresee any healthcare spend in the very near future, and they think that their layoff or furlough is going to be very temporary, a short-term medical plan may be something that they want to look at. What a short-term medical plan is it provides 6 months of coverage in the state of Michigan, but individuals are all medically underwritten. So unlike the individual healthcare ACA plans where there is no individual underwriting, the carriers will look at individuals case by case, and they do not cover pre-existing conditions. So not everyone will apply for these, but they are quite a bit less expensive than ACA compliant plans. But there's more policy exclusions and limitations, less coverage, and generally minimal or no prescription drug coverage. And the short-term medical plans, unlike all of the other plans we talked about that'll be ACA compliant, these are non-ACA compliant, so there's no preventative coverage in these. So the annual physicals, well child visits, flu shots, and those types of preventative things, not covered. So those are the different options you have, Julie. Again, recapping, you have COBRA, the continuation of the group plan, individual health insurance, which is the exchange, all ACA compliant plans. I'm looking to see if maybe your spouse has group coverage through their employer that you could tag onto. Medicaid, if you qualify, My Child for children, and Medicare for those 65 years and older. And for somebody who's just looking for something real low cost and temporary, the short-term medical plan.
Okay, thank you. There are plenty of options for people to choose from.
Yep.
Now, is there anything employees should do now to analyze their options?
Yeah, there are. In all those different options that we talked about, the price variance can be pretty dramatic between all of them. So it's really important to drill down and figure out exactly what you need and where you see your costs going over the next 12 to 18 months to figure out the best plan for you. And to do that, you want to start by, you'll receive COBRA notification in the mail. Every employer is required to send that out, and that'll show you what your cost is going to be for the COBRA plan. That may come directly from the employer, or it may come from a COBRA administrator, but either way, it'll have your rates and your summary of benefits in there. And then if you have any questions with that, you can reach out to your old HR department or the COBRA administrator. And also try to get hold of your most recent explanation of benefits from the last time you did visit a doctor's office or a hospital, because those are pretty good about tracking your deductibles and your copays and listing them on there so you know where you stand with that. And if you have any other questions along those lines, because going back to the different plans, aside from the COBRA plan, all of those other plans, you're starting fresh with deductible and copay for the year. And with the higher deductible health plans so relevant these days, that could be thousands of dollars. And not all plans are January 1st through December 31st either. So the ones that do start January 31st, that's easy to calculate the remaining year. But then again, plans that maybe started March 1st or could be starting June 1st, it's just important to understand where you are throughout your plan, you're on the deductible and the copay, and the explanation of benefits will lay that out for you. And you also want to get a list of the prescription medications that you and your dependents are currently taking and see what those costs will be on all of the different plans, because they'll likely be different on each plan that you choose. If you're under 65 years old, definitely get a quote from the ACA individual marketplace and compare that to your other options. And if you're over age 65, definitely get a quote for what your Medicare would be, and including the supplements in Medicare. And the last thing on Medicare is the prices do vary some. A and B generally are a total of $145, but depending on how much you've paid into the program, that could be upwards of $500, or it could be as low as $0. And then the supplements are priced accordingly as well, so you want to look into those prices. So again, there's about 5 or 6 different firm options that you have. It's important to look at all of them and make the best decision for you and your dependents as well.
Okay, thank you so much. I appreciate both of you answering my questions. And then if anybody else has any more questions they would like us to answer, just, throw them in the comments. And we hope that everybody is staying safe out there.
Thank you.
Thank you.